Greetings, everyone, and welcome to the International Day for the Elimination of Violence Against Women broadcast. My name is Kandice Lewis-Wilson, and I'm the Senior Program Manager at the Center for Public Impact on the SAFE Center program. The SAFE Center is a national research center funded by the Office of Child Support Services to expand safe access to child support, establishment of parenting time services through training, technical assistance, research, and resource development. This is for states, tribal, and local child support agencies and partner organizations in the United States. It is an absolute honor to facilitate this important conversation about child welfare, trauma recovery, and breaking cycles of violence. Today, I'm joined by three distinguished panelists whose work is shaping the future of child welfare. Dr. Allison Jackson, Division Chief at the Children's National Hospital, is a leader in trauma-informed care for abused and neglected children. Dr. Sharon Cooper, a developmental and forensic pediatrician, is renowned for addressing child maltreatment and technology-facilitated exploitation. And Mr. Aswad Thomas, Vice President of the Alliance for Safety and Justice, is a survivor and advocate dedicated to healing and justice for communities impacted by violence. Before we begin, I'd like to invite each of them to take one moment to introduce themselves and share what brought them to this work in child welfare and trauma recovery. Dr. Jackson.
Hello, everyone. It's an honor to be here. Again, my name is Allison Jackson, and I'm a professor of pediatrics at George Washington University here in Washington, D.C., and a division chief of the Child and Adolescent Protection Center at Children's National Hospital, also in Washington, D.C. And really what brought me to this work is just the joy of being a pediatrician, and being privileged to experience patients at their highest moments and at some of their lowest moments. I've been caring for children impacted by abuse and neglect for over 24 years now as a child abuse pediatrician. And through this work, I witnessed not only the results of child abuse on my patients, but also the impact of generational trauma, much of which we know is gender-based, and how it impacts not only the family, but also the community. I've learned so much from my patients, and that is really what has driven me to tell their stories in an effort to help interrupt cycles of abuse, and to advance the healing from trauma for my patients and their caregivers.
Thank you. Dr. Cooper.
Hi, my name is Sharon Cooper, and I'm a developmental and forensic pediatrician. And I migrated from seeing primarily child maltreatment cases in the early 80s to the middle part of 1990 when we began to see technology-facilitated crimes against children and adults. And I've spent now more than 25 years working in the areas of internet crimes against children and the challenges and the long-term impact. I continue to follow children who have been abused sexually, and who have had images made of that form of exploitation, as well as I follow those who have been sold online through internet sites, where therefore we see amazing long-term victim impact to include significant health problems, not just mental health problems, but physical health problems, not just problems related to sexually transmitted infections, but long-term conditions that often are going to be findings like rheumatoid arthritis and connective tissue disorders and autoimmune disorders, which tells us that these individuals have really elevated cortisol levels forever. And because of that, we really want to stop this form of victimization. And if we can't stop it, we need to find ways, the best ways, to rehabilitate survivors who have been victims in cyberspace. So it's been really an honor for me to participate in this conversation, and I'm looking forward to providing some further information.
Thank you, Dr. Cooper. Mr. Thomas.
Hello, everyone. My name is Aswad Thomas. I'm based here in Atlanta, Georgia, in the United States. I'm currently the Vice President of the Alliance for Safety and Justice. We are an organization that aims to replace the overuse of incarceration with more effective public safety solutions rooted in crime prevention, rehabilitation, and support for crime victims. We partner with state elected officials and advocates to pass public safety reforms. So far, we've been able to pass over 100 public safety reforms that have reduced incarceration, expanded access to support for crime victims that also have stopped cycles of crime and also allow more than 10 million people with an opportunity to clear an old criminal record. And like many of the 500,000 members that we represent, I came into this work after becoming a victim of gun violence in 2009. I was shot twice on my back, and those bullets ended my professional basketball career and nearly my life. Like so many survivors, I never received any help after that shooting. So once I recovered, I joined our flagship program, which is called Crime Survivors for Safety and Justice, where I now organize victims of crimes across the country.
Thank you all so much. Once again, I'm so honored to be and share this space with such great leaders in this work. And so I'll start with you, Dr. Jackson. With trauma being so prevalent, especially intergenerational trauma, how can we create healthcare environments that feel safe for individuals to disclose trauma at their own pace?
Well, I think we have to ensure that the workforce in healthcare, whether those individuals are clinical or administrative professionals, that they are first aware how prevalent it is and the impact of adverse experiences that can result in trauma in individuals. There was a groundbreaking study in the 1990s called the Adverse Childhood Experiences Study, which many people are aware of. And it really affirmed that childhood trauma is common. Of course, I'm a pediatrician. So, what I like to say is even if you serve adults, every adult was once a child. And so what I'm speaking to really affects anyone and everyone. Um, and and I think statistically, we understand that that common it that trauma is so common. We know that 1 in 3 women and about 1 in 4 men will experience physical violence by an intimate partner. Uh, and we also know that child maltreatment and intimate partner violence co-occur anywhere from 30 to 60% of the time. And in the United States, that means about 15 million children experience IPV with their caregivers each year. We also know that child maltreatment will be confirmed in about 1 in 8 children in the United States before they are 18 years of age. And sadly, every 5 hours, a child dies from abuse or neglect in the United States. Now, I don't have the statistics for across the world, and I know we're speaking to a global audience, but it's important to know what's common here is common in other places as well. And we also have learned and come to learn that adverse experiences are not limited to the individual or family domain. Other adversities also impact individuals, such as poverty, racism and discrimination, homelessness, and even natural disasters. What was also a profound outcome of the ACE or Adverse Childhood Experiences study was that it showed that experiences such as child abuse, caregiver domestic violence, caregiver mental illness or substance misuse, parental separation or incarceration of a parent, all of these things seem to increase the risk for poor physical and mental health outcomes, including the leading causes of death. So, what some healthcare professionals might have thought where these experiences or events in the lives of our patients could be just simply psychosocial issues um, has been demonstrated to be health issues. And so they're health issues not just in childhood, but across the lifespan. And so health professionals must also be aware that individuals who have experienced violence or abuse don't have a profile demeanor. There is no standard way that trauma shows up in the clinical setting. And so we must convey a message from the front desk to the clinical suite that we are a safe space. It's important to have things like universal education, could be signs or posters or
Yeah.
even little cards that are available to all patients. Staff must be able to recognize potential signs of violence and abuse among patients of all ages, from infants to the elderly.
And you were talking about the different things that kind of amplified this.
Yeah.
And I wanted to get Dr. Cooper's input on that. And we talked about how technology has amplified both the reach and impact of child victimization. So what unique challenges does this pose in addressing child maltreatment? And how can we better support victims who experience such technology-based harms?
Thank you so much for asking me that question. Technology-based crimes are the gift that just continues to give forever. We know that many times when images have been made of children or adolescents or young adults and placed in cyberspace, they're almost impossible to retrieve. And this causes a really severe ongoing paranoia for the victims. They're always afraid. I would strongly encourage everyone to download the Canadian Center for Child Protection study called the Survivor Survey. It was done in 2017 and really had reflected survivors from around the world, not just in Canada at all. This was a really excellent first-person narrative from survivors, and we now recognize how paranoid they are, how they frequently are unable to gain employment because they're always so nervous that they'll be recognized by other people. And in addition to this, what we found from the survivor survey is that the majority of victims who had images made of them were actually abused in their own homes. It wasn't as if it was somebody else who was a stranger or who had kidnapped them or anything of that nature. And we also learned that a very significant number of victims started being sexually abused by multiple offenders who were brought into the home in order to be able to pay money to those who were in the home as parents or caregivers, and that these victims continue to be abused from as young as 3 to 4 years of age all the way up until their teens. So it doesn't follow that criminology thing that we think about, well, there's one person who only wants 12-year-old victims. No, these are individuals who will sell their children to all types of consumers, and that is what makes it so difficult for them. They have growth retardation as a result. They have difficulty specifically with education because they have so many problems with complex post-traumatic stress disorder, which includes dissociative identity disorder. So violence in cyberspace, very often promoted by family members, is a dynamic that is really something we're dealing with.
Yeah. And so, as you talked about just the different impacts, I just go back to one of the conversations that we previously had as we talked, the many weeks before this. And one thing that I just thought about was just Oswald, how you talked about, and there were so many victims and specifically victims of color, like the access to resources after victimization, like the access to those things. And so, they don't have access to services in their own community. So what do you see as the key barriers to access, and what steps can be built to support victims within these communities?
Majority crime victims, especially African American crime victims, don't access services to help them heal and recover post victimization. And our organization as well did a survey of crime victims. Well, we've learned that over 96% of crime victims do not receive victim compensation. It's because they weren't aware of the program or were denied because of the policy barriers that exist. And some of the barriers are as simple as awareness. Too many victims don't know about these services that are available. And also, there are also conditions to receiving victim compensation that prevent many people from being approved access to the program. And that includes like requiring victims cooperate with law enforcement, or if law enforcement says the victim contributed to their own victimization, or in some states, if a victim has a past felony conviction or is on probation or parole, they can't access victim compensation. And most crime victims are managing that trauma that follows after victimization instead of submitting the paperwork or cooperating with law enforcement, where there are often very tight time constraints. For example, in the state of Arizona, the program requires that victims must report a crime within 72 hours eligible for services. So some of these policy barriers is why our organization, Crime Survivor for Safety and Justice, works in states and also nationwide to increase awareness about compensation, also to pass laws that provide more opportunity for victims to get those supports. So we've been able to change compensation laws in about 12 states, and we've played a major role in the pending changes the federal level. And that all happened by listening to crime victims, training them to be advocates, and training them to change laws in their states that impact their lives.
Thank you so much. I just want to thank you all for this incredible conversation. As you know, 20 minutes is not enough to even touch the surface of the depth of child welfare and just services and just policy and procedure for survivors. So I just want to thank you for your insight, your expertise, and your personal stories shared with us today. Your contributions have not only illuminated the challenges within child welfare and trauma recovery, but have also inspired hope and action for meaningful change. So as we conclude, I'd like to leave our audience with one final reflection from you all. What do you believe is the most critical step forward in addressing child welfare challenges in a trauma-informed and supportive way? And I ask that you all keep it to 30 seconds. Dr. Jackson.
So teach others and learn from survivors, listen to survivors. Remember that even those who are struggling have strengths, and so take note of their strengths and tap into them. Remember that disclosure is a process, it's not an event, so don't force it. And making sure that you realize you can't do it all by yourself in your own agency. It's important to partner with other agencies or other professionals to help survivors to the maximum capacity, and to support them. Trauma work can take its toll, so you can't pour from an empty cup. Take care of yourselves too. And the good news is that violence is preventable. So engage in efforts like these to foster resilience and foster the protective factors beyond the bedside.
Thank you. Mr. Thomas.
All survivors need a right to heal. And this right to heal is about guaranteed care for all victims. We need universal crime prevention. Also, we need effective accountability. And we all play a huge role in stopping the cycles of violence and ensuring survivors get services. So if you want to be part of our movement, you can text the word survivor to 27061. Or if you want to donate, you can text the word donate to 27061 to join our movement of survivors.
Thank you, Mr. Thomas. Dr. Cooper.
I would say that the important thing for us to remember is that we have to have realistic expectations for survivors. Delayed disclosure is the rule more so than the exception. I would encourage you to look at the work of Child USA, which has helped us to recognize that the average age of disclosure of child sexual abuse is 52 years of age. Very important for us to have realistic expectations. And the other piece that I'd like to really make sure you understand is that when you have been a victim in cyberspace, you are it's very unlikely that you will disclose, and you will always be paranoid because you're looking over your shoulder hoping that you're not going to be identified. So keep this in mind when we try to help rehabilitate these survivors.
All right. Well, thank you all for your powerful closing remarks. Let's today's discussion remind us of the collective responsibility that we share to create systems that are equitable, compassionate, and effective for the most vulnerable among us. Let's continue to listen, learn, and act together to break cycles of trauma and foster a future where all children can thrive. Thank you, everyone, for joining us. And a special thank you again for our distinguished panelists. Have an amazing day.
Thank you.